My name is Ron Telep. I've lived in West Knoxville for 39 years. I have been in the jewelry business for 27 years. And I have 2 children, and I'm an avid gardener. Love my grandchildren.
My name is Ron Telep. I'm originally from Michigan, been here in Knoxville for the past 25 years. Very active in sports. About 5 years ago, we were, my wife's brother and his wife were in town from Florida, and we went bowling because they're avid bowlers. And just out of the blue, my knee went out on me. I just lost all control of it right there at the bowling alley. So I had to have it scoped, and I went to Dr. Cates through the advice of a family friend, and had arthroscopic done on it at that point, and seemed to work out pretty well. It seemed to, be better than it was. And after a couple years, I had to go back and get cortisone shots, and those became more frequent. And I finally decided that it was time to get the reconstruction done.
Well, my story is a little different from Ron's. I fell water skiing when I was 21 years old and had my first surgery, a ligament tear. So that began my knee adventure when I was 21 years old. My knee did great for about 10 years, and then I was starting to have some more discomfort and the gritting and the popping, and had arthroscopic, my second surgery, and that helped for maybe another 10 years. Then I started having unbearable pain that was disrupting my lifestyle. I couldn't kneel, I couldn't sit, I couldn't stand, I couldn't garden. I couldn't get up and down off the floor with my grandchildren.
I went to see Dr. Cates, and we had been talking about replacement for quite a while, because we both knew it had to be done, but I hadn't scheduled it. We decided when to schedule it. He set me up with all the pre-op program that had to be done, the book, the class, all the scheduling.
But the knee book is something that you receive. It's a class that you go to for 2 hours, and you do need to open it, and you do need to read it, and you do need to do all of your exercises, and it helps you get your home ready. Little things like picking up rugs, little things like perhaps your animals may need to stay with somebody else the first week or 2 so that you don't have animals running.
Post-op was an experience. I woke up in the hospital, and almost within the first couple hours, they've got you up and sitting on the edge of your bed.
Well, to be honest, when I woke up and the next morning when they took my bandages off and I saw the 37 staples, I thought to myself, what have I got myself into here? Because it's not a quick fix. It's a journey. It's a long journey. And the first 3 months for me were very difficult. All I could manage was to go to therapy Monday, Wednesday, Friday. I had a lot of help. That's a key. You need people to chauffeur you. You need people to cook for you. My church practically lived here for those 3 months, and I'm very thankful for that. I was able to walk without a cane quickly, and that was my plus, because the knee, since it was shift, as soon as I had the surgery, it was strong. It hurt like the dickens, but it was strong, and the first time I stood up and it didn't move, it's like, okay, I'm going to be able to make it through this. And I had the support of my husband, who kept reminding me that this is positive pain. This is not negative pain. And that was great advice.
Physical therapy is very important, to hit it hard right from the very beginning. I started going to TOC, and I've been going there ever since, and those people are amazing there. They've got me off the walker, got me off the cane. I'm already walking. I haven't even been out of the hospital a month, and I'm already walking without any help at all.
I know half of it was the doctor and half of it was rehab, and that was explained to me up front. Dr. Cates says, I'm going to do my half, you have to do your half. And that's what makes a whole.
It's all about you. You're the one that has to have the positive attitude on a day-to-day basis. Even if you don't want to go to therapy, you need to get up and you need to go to therapy. Once you get there, it's all worth it.
My best advice is to talk to someone who has had this done, If you ask Dr. Cates' office, they can give you names of people because everybody's going to be different. And I was not able to do exercises other than the small ones that are in the book. And so I was very weak from my surgery, which made my rehab much harder. I had to rebuild everything back.
I mean, I've already seen myself doing things pain-free that used to cause me discomfort prior to the surgery. Being able to go out in the yard and shoot baskets the other day with my grandson that we couldn't do. But nevertheless, just to be able to do the everyday things that give me joy.
I can garden, I can plant, I can do anything. I can dance. I can dance again.